I'd like to preface this with saying I'm not here to give a scientific treatise on the chemistry of the diagnosis of toxicity. If you want, that could be the subject of a future discussion, possibly given by Dr. Haley, Dr. Richard Lord of Metametrix Functional Laboratory, or Dr. Jim Woods of the University of Washington. I'm sure there's many other qualified people probably in this group. I am a clinician. I treat patients, and I want to give you a method of diagnosing toxicity which is scientific, reproducible, and clinically useful. At the end of my talk, you will be able to diagnose toxicity safely and with absolutely no side effects. Using this method is something every licensed health professional in this room is qualified to do. I've been asked where I've been because I've missed the last number of meetings, and I've been very busy getting my master's in nutrition, and obviously with an emphasis in toxicity. I say obviously because of being an active member of the IAOMT. I have been actively pursuing the selling of my practice, and the young man who has agreed to purchase my practice is here. I'm happy to see him here, and I've told him one of the selling points is not only doing better for patients, yourself, and your family, but you have no competition. I'm right outside of Baltimore, and basically I have no competition because there's no one else doing it correctly. So a number of years ago, when I was very active, when we were formulating what we called periodontal protocols for the protocols for biocompatible periodontal therapy, I think now they're called, Phil can correct me, but standards of practice. Makes them a little less official, but that's all right. When we were doing that, I kept asking what was the cause of periodontal infection. And we kept getting down more and more to bacteria, viruses, fungus, yeast. And I met some of the world's leading immunologists, much to my pleasure and honor, people like Aristo Vijdani, Veer Stedkel, and others. And I would say to them, why does a person's immune system break down? And the answer I got in every case was, we aren't sure, makes you a little scared, but we think it has to do more with nutrition than anything else. That led me on my quest to become a nutritionist. I also had dealt early on in my career, well, middle of the career, before I really was removing amalgam safely and properly, with a really severe depression. The kind that has one wondering if the world would be better off without them. Not a pleasant place to be. And at the time I did what I now consider old-fashioned, and it's going to shock a lot of you and probably anger a lot of you, but I did a DMSA challenge. 2,3-dimercaptosuccinic acid is still today considered the standard for doing toxicity testing. Well, it's not anymore. That's going out, it's going by the boards, and I'll tell you why this morning. But I did the DMSA, and I got a call from David Quigg out at Doctor's Data, where I had sent it at the time, and David said, I don't know how you're walking the streets. I didn't want to tell him, well, I preferred not to be at this time, but he said, your mercury's so off the chart, I can't even measure it. So I started into the process of detoxifying myself. Many of you have been through this. And I found, like Edison's light bulb, 10,000 ways that didn't work. And it got rather frustrating. And I finally, through help with people like Boyd Haley and others, developed a method of toxicity that worked for me. I've refined that greatly over the years, and now I'm using it with patients on a regular basis. So that brought me to where we are now, right here, and going to talk about this. In my opinion, toxicity will be the major health issue of the 21st century. It's growing. It's in all the magazines now. They're talking about toxicity. And you might say, well, yeah, get those amalgams out. Yeah, that's one part of the puzzle. That's one part of the puzzle. And I agree with that. Let me just give you 3 quick examples I noticed over the last couple days out here in Las Vegas. Kathy and I got out here a little early to have some restful time and sat by the pool observing potential patients. I guess that's restful. One of the things we saw was a young mother with her baby, cute little kid. And Kathy and I have 7 grandchildren, so we love cute little kids. All 7 of ours were much cuter than this baby, but that's not the point. I digress. But she had a plastic bottle out next to the pool with juice in it, sitting in the sun on the hot concrete. Let me tell you, if you measure the amount of xenoestrogens in that baby after drinking that bottle of juice, it's going to be elevated. It's a terrible place for a, 6-month-old calf? Something like that to be. Plastic in a microwave is another way, just heating these water bottles. If you have water bottles that are plastic and they get heated, they're releasing, that plastic releases xenoestrogens. It's just a fact, easy measurable chemistry fact. If you put plastic in the microwave and it says microwave safe, that means it won't melt, it won't burn, and it won't explode. It will give off high amounts of xenoestrogens. You ever wonder why so many women now have so many issues with hormones? Many at a young age. Never used to be true. You can't turn on the news, at least the TV here in town, and I know this is true at home, without hearing about erectile dysfunction. ED, I mean, my God, we're surrounded by it. Never was heard of years ago. You think xenoestrogens might have something to do with it? Hello? And if any of you have wood decks, you treat those wood decks once a year, every other year, whatever, with a preservative, something to seal it. On a hot day in the summer, when you have a thunderstorm, walk out and look at the little puddles that form on that deck, and look at the puddles under the deck. And what you'll see is a green, slimy type, oily substance. That substance is highly toxic, petrochemical. I wouldn't walk on that barefoot, and I sure wouldn't let my kids go on that barefoot. That's toxicity surrounding us. Yesterday's weather forecast for Las Vegas, the weatherman threw out a beautiful day. The only problem, I emphasize only problem, is a moderate amount of carbon monoxide in the air. Well, carbon monoxide will kill brain cells. What's a moderate amount? What's a small amount? What's a large amount? The problem is that we are surrounded by toxicity. But we're here mainly to discuss heavy metal toxicity and mercury toxicity in particular. Toxicity can be caused of multiple things. Multiple chemical sensitivity. This does exist. All of you here know it exists, but till a few years ago, we were told there was no such thing. These people were neurotic. And they reacted to everything because they were neurotic. Well, if you can measure something in someone's body, that's not a neurosis. One of the wonderful things about a background in psychology is you can be a psychologist, you don't have to worry about measuring anything. It's real easy. You have 40 patients, you got 40 hours a week filled. If you want to go on vacation, you tell them they're fine for 2 weeks. And if one of them dies, you just have to replace one patient, not too bad. But multiple chemical sensitivity does exist, it's real. Behavioral and learning disorders, such as ADD, ADHD, both on the autism spectrum. Another one on that spectrum is PDD-NOS, pervasive developmental disorder not otherwise specified. Immune dysfunctions, including autoimmune diseases like arthritis, chronic fatigue. According to the International and American Association of Clinical Nutritionists, the #1 complaint to its members by patients is chronic fatigue. American Medical Association says chronic fatigue is #2 following pain, both of which can be related to toxicity. But chronic fatigue, as Dr. Godfrey just said, highly related. Neurological and mental emotional disorders, such as Alzheimer's, dementia, Parkinsonism, depression. If you can't believe it, I can tell you about depression from my own experience. As I got the mercury out, very frankly, the mood lifted. And it's the only thing that had changed in my life. Alzheimer's, Boyd, and dementia, Boyd can document over and over and over in his research. So you've heard all that. Now, how did I ever get to the point of talking about what we're going to talk about today, a porphyrin profile test? Well, a couple years ago, I think it was 2 years ago, in an email or phone exchange with Boyd, I don't know whether we were emailing or talking on the phone, and if we were, it probably had to deal more with Maryland, Kentucky basketball. The last few years I don't talk to Boyd about that anymore, but Maryland's not doing that well. But we're talking about women's basketball, that's great. But I happen to say that in testing people and doing DMSA challenges that I wasn't happy with the results. The results were coming back in too many people negative, some people positive, but too many people were negative, and I did it correctly. If you want to do it correctly with DMSA, you have to give 20 milligrams per kilogram of body weight. It's a big dose. It's a lot of tablets. And there's several things that are a problem with it. One is people tend to not take all that you tell them because they think, I can't take all of these. For someone my size, 18 small tablets, 100 milligrams each. They tend not to do it. And then doctors tend not to recommend the right amount. So if you aren't recommended the right amount to pull the mercury out, why are you giving the medicine? It's not going to work, most cases. But you also get, and Boyd put me onto this, a tremendous amount of false negatives. So he put me in touch with a fellow out at the University of Washington named Jim Woods, who had written quite a few papers on the porphyrin profile. And then I got in touch with Laboratory Philippe Auguste over in Paris and started learning about porphyrin profiles and what porphyrin does in the body. And then both Kathy and I have become DAN certified, the group called Defeat Autism Now. Because as I leave dentistry, I feel I'm so young I have to work, so I'm setting up a nutritional counseling practice so that I can remain occupied. And the DAN people, the Defeat Autism Now group, the PhDs and MDs in there, were all telling me that they had stopped doing toxicity testing on small children who are on the autism spectrum. The reason they had stopped, and I mean this is many, many docs had told me this. The reason they had stopped is twofold. One, they didn't trust the test. Two, the parents wouldn't give the kid all that they had to give to really get a true test, if there is such a thing with DMSI. And thirdly, when they did all this and it came back negative, it meant nothing, because what they were finding is that they would get the mercury out of this child at all to any extent the child would improve. And the mercury in this child largely came at one time from thimerosal in the vaccines. Contrary to what you read in the press, thimerosal is not out of all vaccines. There's still a number that contain thimerosal. So the problem is still there. And Stephanie Cave spoke to this group a few years ago, so you already know our vaccine policy in this country is insane to start with. I won't even go to Gardasil. You know what Gardasil is for the human papillomavirus? An easily preventable infection with a little common sense. And now we're going to give young teens and preteens this vaccine. It's nuts. So we need a sane vaccination policy. But that led me to say something's really wrong here. Our testing just doesn't make sense. Now, what are porphyrins? Well, porphyrins basically can be measured in the urine and serve as biomarkers of the effects of toxins on the heme biosynthetic pathway. Heme is what gives red blood cells their color. Heme is important for the red blood cells to be able to carry oxygen. Now think about that. That's a pretty important substance. It carries oxygen to the cells. And heme is essential for the proper function of many proteins, including oxygen transport, energy production, and detoxification. So we know that heme is actually required at the active sites of oxygen binding, oxygen utilizing, and oxidizing systems, such as hemoglobin, cytochromes, and mitochondrial electron carriers. The porphyrin pathway involves 8 enzymes. They're in a sequence beginning and ending in the mitochondria of the cells. Now, mitochondria is what gives us energy. Mitochondria are like the engines, the fuel, the car. They're the engines. They're the engines that fuel our body. So if anything goes wrong in the mitochondria and the mitochondria can't function, we lose energy production. 4 steps occur in the cytosol and 4 actually in the mitochondria. Again, you can't see it, I apologize. We'll get that corrected, but that won't do us any good this morning. But the restriction of an enzyme, which is active in the porphyrin pathway, produces backups of 1 or more enzymes, or 1 or more porphyrinogens, leading to the rise of porphyrins in the urine. Now what I mean by that is if you have A to B in the mitochondria, this is a reaction. Substance A is changed to substance B, changed to substance C, and so on for those 8 steps, and one of those enzymes is inactivated, what happens is you have a buildup of the substance preceding the one in the action. So if A to B, the enzyme there is enzyme X, and that's blocked because a toxin gets in and grabs hold of that enzyme, you'll have a buildup of A. And what those come out as is porphyrins in the urine. Pretty easily measured. Sensitive test, but pretty easily measured. And remember what I said, the mitochondria are responsible for energy metabolism. And mitochondrial DNA, and mitochondria are found in large numbers, of course, in the muscles for the energy. This mitochondrial DNA is very susceptible to oxidative stress. In fact, it's 20 times as sensitive to oxidative stress as nuclear DNA. And we all know the importance of DNA. One cause of this oxidative stress can be toxicity. There's multiple causes, which through this whole toxicity thing has been a way of medicine, dentistry, the health professions say, well, you can't say it's just toxicity. Yes, we can. And you're going to know why in just a few minutes. Nuclear DNA is easily repaired. It's very, very protected. So actually in the nucleus of the cell it's protected. But when in a pro-oxidative state, and we all know pro-oxidative states with reactive oxygen species and why we take antioxidants to help get rid of toxins in the body. We know that, but we know that when we're in that pro-oxidative state, the detoxification mechanisms are overwhelmed. They can't handle it. So you have basically 5 ways of eliminating toxins from the body. You have the gut, the bowel, you have the kidneys, you have the skin, you have the liver, and you have the lungs. That's what eliminates toxins. As any of those 5 or all 5 are overwhelmed by things like plastic bottles, the water from plastic bottles or juice been heated, microwave plastic heated, wood decks, the air we breathe, the old song, all we need is the air we breathe. Well, maybe not. The mitochondria take the hit. So you are going to find this fatigue and this lack of energy. Now, why would you evaluate porphyrins? Well, probably that answer is self-evident from what I just said. But we know that there are specific patterns of porphyrin elevations in urine which serve as functional markers of toxicity from toxic metals. For example, mercury, lead, arsenic, or organic chemicals. The one important to most of you here on a professional basis is mercury. Around your home and in your own body, it's all of them. And it's actually, I believe, mercury, we're going to show, we've already shown how bad that is, but this organic chemicals is going to become a real rallying cry in the 21st century in dealing with toxicity. So we know that those will show certain porphyrin elevations, and each one is separate. The differentiation of heavy metal toxicity from heavy metal exposure. Now what's important is to know, and we're going to deal with this more, what Boyd Haley has referred to over and over and over, and that's non-excretors. Okay? Excretors get rid of toxins, like mercury. Non-excretors don't. And that's where the APO gene comes in, the APO44 comes in, down to 2,2, that Dr. Godfrey just talked about. So we know that some people will be good excretors, some people won't. Different things cause you to not be, in addition to genetics. It could be that males with, I've heard 7-to-1 males to females on the ASD. Dr. Godfrey said 4-to-1. Either one's too high. But a lot of that has to do with testosterone. That causes the person to be a non-excreter, usually male, but a lot of females are high in testosterone. So non-excreters will have a problem. And this porphyrin test, these porphyrins will show the difference between just toxicity or toxicity from just exposure. It will clearly demonstrate mercury's effect in dental patients with amalgams. And I'm going to show you a slide on that, but Dr. Godfrey already did. The people with amalgams have higher mercury in their body than people without dental amalgams. Also on why evaluate porphyrins, it will give clinicians the ability to test for heavy metals without DMSA, DMPS, and EDTA. All three of those have a problem. DMSA, I already told you about. That is sort of the gold standard right now in the nutritional community, physicians and nutritionists, for testing heavy metal toxicity, especially mercury. I don't believe it works because it doesn't get into the cells. It's almost certainly not getting into brain cells. Boyd, I think, will verify that for me. So it may show nothing when something's there. DMPS is not FDA certified for use in this manner. Now, that's not necessarily real important. It says unless someone has something go wrong in your treatment, may have nothing to do with you, but we're in a litigious society, are we not? We're in a board-oriented society, and everyone here knows about that. So I would not use DMPS until it's certified for that use. You're hanging out there. You are hanging out there. And EDTA is much more effective for lead. So if we're interested in mercury, as most dentists would be, the one you want to use here is DMSA, but it doesn't really work, in my opinion. And I think science verifies that. It's a good way of monitoring patients before and during chelation therapy. So you can use the porphyrin profile to check people before you remove amalgams. You can use it after they're removed. You can use it in 6 months. You can use it on yourself. If you're just whipping those amalgams out with no protection at all of anybody right now, then you can check yourself on a porphyrin profile, and then as you become detoxed, God help you, you can tell whether it's working. It's obviously superior to hair or challenged urine. Challenged urine for the reasons I've said. The toxicity itself caused by DMSA, the fact that you challenges, and the fact that you get a lot of false negatives. Hair is one of the absolute worst ways to test for mercury toxicity. Boyd has pointed this out again. I hate to keep going back to Boyd, but the fact is he's a pioneer in this field, and pioneers should be referred to and given credit. In a study that they did a few years ago at the University of Kentucky, they found that in 20 people who had died, elderly people, with Alzheimer's and dementia, and another group that had not been diagnosed with Alzheimer's and dementia seemed mentally fine, they found that in the nails and hair, the people with the Alzheimer's and dementia had low mercury, low heavy metals. The people who didn't have it, have this high toxic load in their nails and hair, were the ones with the, I'm getting this backwards, the ones who had the high mercury did not have dementia. Those with low mercury in their hair and nails were the ones with the Alzheimer's. The reason it turns out is these are what Boyd referred to as non-excretors. Well, the hair is one way that things are excreted. It's a great way to measure vitamin and mineral content and whether the person needs to be supplemented in that way. There are better ways to do it, but that is a great way to do it. But it will not tell you if you have a heavy metal problem. So don't do it. It just doesn't work. And as I said, with the challenged urine, the fact is that people weren't taking enough, the docs weren't giving enough, and finally the people I talked to in DANS, even those who wrote about using DMSA, did not use it. They tried to use it for chelation to get it out of the body, but again, I don't think personally that's the best way to do it. And it measures the biochemical damage caused by toxin exposure, and we'll look at that a little bit more when we get to the test because it shows the damage to heem. It's a very accurate measurement, scientifically accepted. So the two important results to keep in mind are that the porphyrin profile, this test, shows the presence of toxicity, but more importantly, in my opinion, it shows whether that presence is causing a physiological problem. Let me say that again. It not only shows the presence of toxicity, but whether that toxicity is causing a problem. Now, what's good is it may show that toxicity is causing a problem before the person has physical symptoms, before they have mental symptoms. You can catch a person before they're severely depressed, before they're severely fatigued, before they're dead. So that's why I recommend this test, and that's why I want to talk to you about it. Another reason to evaluate porphyrins, it detects the toxicity of therapeutic drugs. Now that's something that most of the dentists in here probably aren't interested in doing. The physicians probably are. But therapeutic drugs are toxic. Pick up the paper any day and just pick a different drug and it'll be featured in there. I don't care whether it's Celebrex. Have you seen Celebrex's latest commercial? It's no more dangerous than anything else. There's a recommendation. And the other things, the whole serotonin reuptake inhibitors, the Paxil type drugs, all have enormous side effects. One of which these antidepressants do is cause a dramatic increase in suicide. Boy, that's a way to cure depression. It's also a scientifically accurate test which can be used to educate a patient and to defend mercury removal. If you have boards that are out to get you, some states still do, then if you are doing this test on the patients, now a patient has a right to ask that amalgams be removed. You still don't absolutely have a right to say that your problems are caused by amalgam. In fact, even with the porphyrin profile, it's a little difficult to say your problems are caused by mercury. But you can do a test that's going to show that that's a problem. Now, like I said, the person come in and say, I want these amalgams out. That's okay. The reason that was decided that was okay, and much to the chagrin of many dental boards, was that the Supreme Court decided a number of years ago that a teenager could go into a hospital and have an abortion without her parents knowing. Well, you sure can remove amalgams from an adult. So that whole thing went by the wayside. But you might want to show people that there's a problem. You might want to show that they're getting better. You might want to give an indication of what's going on. And this is the way to do it. It's a way to monitor your own staff and yourself. I mean, you can go home and do this. What I've noticed, very frankly, is that a lot of members, even in this organization, don't really maybe want to know if you have a problem because of what I went through. And I know other dentists here who I've consulted with nutritionally went through getting the mercury out once you find it. Well, there are ways of doing that now that work. Believe me, they work. And I'm not going to give anyone's name here, but there are members of this organization that I've helped treat. And they got the mercury out, many after years of trying to do it. So it's not anything to be afraid of on monitoring your own staff and yourself. Your own staff, you have to explain it maybe, but hey, good luck doing that. Now, a little bit on the same thing you just heard from Dr. Godfrey, and I'm going to tell it with a Midwestern instead of a New Zealand accent. The rats exposed to 10 parts per million methylmercury hydroxide in drinking water for 6 weeks, what we found was these particular porphyrins went up. The first one is pentacarboxyporphyrin, the second is precoproporphyrin, and the third is coproporphyrin. They're just different names to give into the different porphyrins. There's not just one porphyrin. They're all related because they work with the mitochondria, giving the body energy, transporting heme, building heme. But these are three, particularly on our test that you'll see a sample test, that we look at that indicate mercury toxicity. In a mercury toxic person, most of the time, overwhelming amount of the time, you'll find these three, pentacarboxyporphyrin, pre-coproporphyrin and coproporphyrin. And they found that in rats exposed to this methylmercury. And I think this was basically the same test that Dr. Godfrey talked about. Now, this is on the effects of mercury removal by DMPS, and these were people pretty high. There's a couple things important about this slide. That the DMPS will remove mercury. You can see how the porphyrins drop, and these are an absolute measure of mercury toxicity. So it does work to an extent, but there's still a lot of mercury left. Look at this column. There's still a lot of mercury there. So it's not removing it all. That's why I believe very much in more natural solutions through vitamin mineral type therapy, homeopathy, herbal type therapies. But that brings up what is the best way to detox, and that's not what I'm here to talk about. I'm here to tell you how to first diagnose it. Now, the next slide shows the relationship of porphyrins to mercury body burden. And again, this is using DMPS. That's just because that's how most of this research has been done on what the effects are of pre-chelation, post-chelation. But the important thing you can see is that the mercury drops as you have the amount of mercury in the urine, and this is a control, but the porphyrins decrease, show a decrease. The decrease in the porphyrins show a decrease in the mercury body burden. So although I said DMPS isn't the best way, it does show that porphyrin profiles do work. They show the extent of the mercury body burden. Now, how do you do a porphyrin profile? Well, you aren't going to believe this with all the extremely complicated tests. I've had dentists call me and say, I am really afraid to give DMSA. I'm not trained to do that. My dental board will come after me. With my master's in nutrition, I'm accepted that I can use DMSA. It's FDA approved, so I can do that. I don't for the reasons I've stated, especially my personal experience. But other ways of doing it are drawing blood. Well, if you got high mercury in your blood, see ya. And first I want to know if you owe me money, please pay cash, not a check. Simple overnight urine. That's all it is. That's a urine collection. You void before you go to bed, and you collect the urine. If you get up and urinate overnight, you collect that, and then first morning urine. If you're a middle-aged male, you collect midnight, 1:30, 3 o'clock. And then when you get all the toxins out, then you don't have to do that anymore. Think that doesn't affect prostate? The xenoestrogen? Sure it does. There's no challenges, no medicines, no side effects, no penetration of the body at all. The person simply either pays the lab, or probably the best way to do it is to have the lab bill you, and we'll talk about labs in a minute. And that way they can get the test done. They collect it, they FedEx it overnight, you freeze the urine, you actually put it in a little tube, you aliquot off a portion into a little tube, you freeze that tube. The next day you keep it frozen. Say you take it into the office, you put it in the freezer, in the box, all packed up, and FedEx picks it up, and the next morning the lab has it to do their testing. And that's as simple as it is. So you do this, you don't want to do it on a, I wouldn't do it on a Thursday, Friday, or Saturday, because it may get stuck in FedEx. It may not. You want to have as fresh a urine frozen as you can. So I would do it on Sunday night, Monday night, Tuesday night, even Wednesday night is fine. The earlier the better. But there's absolutely no side effects. You don't have to draw any blood. You don't have to give any pills. You don't have to do any of that for yourself or your patients or your family or your staff. Now back to my story, the two top complaints about the porphyrin profile after, you know, I have to tell you that over the 2 years we've been working on this, there are many times I thought, man, I wish I had not said anything to Boyd. Because I have dealt with so many PhDs who know so much chemistry that I either never knew or forgot. It's been a real challenge. Because some of them have trouble explaining these chemical reactions in the mitochondria, as some of you do, the dangers of mercury, because it's become too second nature to them. But I did get a lot of information from people, and the biggest thing against the porphyrin profile was it's extremely sensitive. It's been tried in the past. They've known about porphyrins for many, many years, and they're indication of heavy metal toxicity. However, what they didn't know was that how sensitive it was, and it didn't seem to work early on. So a lot of people got very frustrated with it and stopped using it. That has been worked out. And we'll talk about that. It's also fairly difficult to interpret a test. Now I'll show you some tests. It's not for mercury. It's very simple. But when a test comes back, it may have a lot of different toxins going on, and it's difficult to interpret. There was a lab in France, Laboratoire Philippe Auguste, headed by a PhD named Robert Nataf, who they did the porphyrin profile. They give a synopsis for you of how to interpret the test results when you get them. And you can overnight it to France, to Paris. But I right away wanted someone in this country that I could deal with, that I could talk to in English, and their emails were fine, but you could tell even in their emails from Laboratoire Philippe Auguste that they had trouble with the English language. And that's okay, but I was sort of learning on the fly, but they did have an interpretation. The problem with the test that I ran into was there wasn't this control of the sensitivity for the porphyrins. The urine cannot be exposed to heat. It cannot be exposed to light. So we want to keep it frozen in a dark container all the way from the time it's put in that test tube and frozen to the laboratory. So the functional medicine lab I enjoy working with the most of any around, and there are several good ones. There's Great Plains, there's Great Smokies, but I have really enjoyed working with a lab called Metametrix. Metametrix has an organic acid test that just, I don't think anything compares with it. And that's for ASD and for general well-being, the #1 test. It's called an OAT, organic acid test. And Steve Wickham is at the Metametrix table in here. I asked them to come down so that you could follow up on this porphyrin profile with them. I have nothing to do with them financially, but Steve has become a friend, and he put me on actually to Richard Lord. And Richard Lord is, I think, the head of science for Metametrix. The chief guy, as I understand, is Andy Brawley. But they came back to me and they said, we really can't do that test. We have too many tests in the pipeline. We tried porphyrin profile a number of years ago. People did it for a while. They stopped doing it. They went through all the excuses. Well, those of you who remember me from the periodontal committee know that if there's nothing else, I'm persistent. And I think they finally agreed to do the test because they said, this guy is so obnoxious, we can't get any other emails, our box is overflowing, we'll just do the test. Well, last September at the DAN conference in Alexandria, Virginia, Metametrix announced the presentation of their porphyrin profile. And all of the problems that we've had with the test being so sensitive have been taken care of. You actually have this frozen tube on a frozen ice pack. You freeze the tube in the ice pack first. The patient then aliquots off a portion, puts the tube back into its little space it created in the ice block. It goes into a styrofoam container, all surrounded by metal to keep anything from leaking out and any light from getting in. It's sealed. It's put in a FedEx envelope and it's sent off overnight. So they've eliminated the sensitivity. Isn't that a great term? Steve's right there, or I'd not be ashamed to say we, but he knows that I didn't have anything to do with that. I recommend talking to Steve over at the Metametrix booth if you have an interest in toxicity testing for yourself, your staff, or your patients. And like I said, medical legally, this is a dynamite way to protect yourself. So talk to him. A couple years ago, I think you found out when I recommended the microscope from Oratech, you didn't get steered wrong. And I don't feel you're being steered wrong with using a porphyrin profile. The microscope, under the gum irrigation, and the porphyrin profile. I think those are good recommendations. Next slide here shows, and you have it in your book, the results of a porphyrin profile from Metametrix labs. Now, as far as interpreting the tests, People worry about how do I interpret the test. The French came with an interpretation. This test does not. But you can pick up the phone and call an 800 number, and you can talk to someone familiar with the meaning of a porphyrin profile, and they'll talk you through tests. That's their job, and they don't mind doing it. And they'll spend as much time as you need. But the important point on this test right here is to look at the pentacarboxyporphyrin, the precoproporphyrin, and the coproporphyrin 1 and 3. All three are out here, and this little box is important because it's over, when you look at the numbers on the side here, it says a 95% reference level. If you're above that 95%, you got a problem. And the only way these porphyrins would show is if the heme pathway has been interrupted. The enzyme's been interrupted. The side effect is porphyrins, okay? So that's what you want to look at. So this person is mercury toxic. Absolutely. I don't care if they don't have symptoms. They will. Are they a non-excreter? I don't know. Probably so. They may be exposed to high amounts of amalgam. You look at the average dental office where that vapor's just spewing off. Harold Lowe, the scientific director for the American Dental Association, conceded to me in a little debate we had before Boyd educated me not to bother, and Dave Kennedy, not to bother debating these people. I used to try it. Oh, jeez. But he said that amalgams have to be removed properly. Did I understand that? I said, yes, do you? One, why are you still putting them in? Nothing's forever. That tooth that was filled was made by God, and he's better than me. And secondly, when you remove them, why aren't you teaching dental students the proper way to do it? If that sounds familiar, I've used that line here before. And so we know that this person has a problem. If you're going to detox that person and they have amalgams, this may be the most important issue of the day. Get those amalgams out before you start a detox program. I think it's horrendous to detox anyone with amalgams in their mouth. I don't care the excuse. You know, we so often hear in our profession, how am I doing on time? Okay. In our profession, we often hear, well, they can't afford to get the amalgams out. You know, thank God that mentality does not pervade the seller of, thank you, of big screen TVs. Actually, I had a man come in once and told me, this is a true story, and I digress a bit, but he couldn't get he needed a crown on a tooth, and I told him we'd have to remove the amalgam, do a core, and all that bit. I gave him the price. He said, came back about a week later, and he said, he came into the office to see me because he said, I can't do the crown. I said, why? He said, my insurance company won't let me. Okay. I said, well, you know, it's not up to them, it's up to you, but the point is that you really need a crown on this tooth. Well, it turns out his plan wasn't real good, and that's beside the point. But I went out a couple months later. I was in a Circuit City, and I was waiting for something I was picking up, and I happened to see big screen TVs. And so I went over and I was just looking at them, and I was amazed at how much they cost. This is many years ago, actually. And now they're even more. But I thought, who in the world puts that kind of money out for a TV? I forgot about our children. But, I digress again. But who walks up to me and says, can I help you? And I start turning around. He says, Dr. Baldwin. It's this guy, this patient. He said, you're looking at the big screen TVs? I said, yeah. He said, can I interest you in one of them? These are the state of the art. I said, oh no, my insurance company won't let me get that. He walked away, and we haven't spoken since. That's a blow-up of it. I didn't realize this was on here. It's just a blow-up. And like I said, what they are using as important is the 95% reference level. As a nutritionist and as a dentist, I'm getting into this area and saying, hey, there's some real problems with other toxins, but they'll go by the wayside as we take care of amalgam. Many people will regress to, if you want to call it that, downgrade to this level just by removal of oral amalgams from their mouth. That's all you have to do. No detox necessary. Dentists who have been doing this for years, is a different situation. We also have environmental toxin-induced porphyrias. And this shows the different things like the organotoxins. I was talking about the plastics, all these things in our environment, just endemic to our environment. Mercury, you may know. I don't know if any of you get a newsletter by a fellow named Dr. Jeff Moss. Jeff has spoken to this group before. He's spoken to the Holistic Dental Association a couple times. Jeff's a good friend of mine, and he just had an 8-month series on mercury and saying how endemic it is in our society. It's everywhere. It's being used for everything. Well, the point that I made to Jeff, and he makes in his newsletter, thank goodness, is that you do have certain means of not being exposed. Don't put plastic in a microwave. In fact, we've gotten rid of our microwaves. We don't even use them. So that's important. That's important because there's no real need for it. Now, I still can't see that a cup of decaf coffee reheated in a pot is as good as in a microwave, but I don't do it anymore anyway. But we don't have to have mercury fillings in our teeth. We don't have to have mercury in our vaccines, for God's sake. Some of you may have seen, talking about vaccines, this year when there was some problem with the flu vaccine, and they said, well, there was mercury still in some of it, and a guy from the CDC, a PhD, actually said, well, we can't just dump it all. It's going to be gone in a couple of years. It'll be gone. Oh, my God. What the government wastes money on, they can't just get rid of these vaccines. It's just incredible. So, again, what you want to do is look at the other causes. If you have an alcoholic, someone who has, you want to get rid of the other causes, oral contraceptives, antibiotics, read that down through that. You want to get rid of those things first. And I use the extreme example that I always use with people. Have you, when they come in with this undefined pain, have you seen your physician? Has he ruled out medical causes? I don't want to give you a bottle of vitamin C if you have lung cancer. That doesn't make sense. If you're having all these strange medical problems, I don't want to just remove your amalgams if the medical people haven't said to you, we just can't find anything. Of course, you know they've written 10 prescriptions, whether they find anything or not, but that's not even the point. So you do want to be careful. You can't take people that are in this category and then say the porphyrin profile shows any of this. First, rule this out, and most of those are, easy to rule out. So, this is the interpretation of the porphyrin profile. And again, you can be helped by Metametrix on this. And Metametrix is the only lab I know of doing this to eliminate the problems with sensitivity. That's why I recommend them. It's that simple. If others start doing it the right way, fine. But right now, they're the only ones. Here you see mercury. That's the major concern of a lot of people. Those of you with small children, you're going to be high in a couple points here because Fisher-Price, the ultimate maker of toys, the safest company in the world, gets them from China. You know, you can buy toys made in the United States. I saw a guy on Fox News yesterday who has a company that makes toys, and they have none of the problems with it. They have none of the lead. They have no problems like that, but they don't get any government subsidies. The Chinese do. Interesting. And the xenobiotics. That's how you can interpret it. Looking at these porphyrins, and if everything's real high, then you've got all kinds of toxicities. It's not that difficult. You just start on a detox program. Now, let me tell you something, too, that there's two rules that I call them TAC rules. And this came from, what's his name, Kath? Dan, founder of Dan? Sidney McDonald Baker. Sid Baker came up with the TAC rules. If you are sitting on a TAC, you have to take an awful lot of aspirin, put in their antibiotics, put in their vitamin C, put in whatever you want, to stop that TAC from hurting. And it probably won't. You have to remove the TAC. If you're sitting on 2 TACs, removing 1 TAC will not give you 50% relief. Now that has to do with the mercury in the mouth. If you have a problem with mercury, taking all the nutrients in the world isn't going to take care of it if you have amalgams in your mouth. If you remove some of the amalgams, but not all, it's not going to give you a 50% or any percent relief. That's the 2 TAC rules. And I'd like to ask you, if you give mepivacaine hydrochloride to a patient, do you take a blood pressure first? I hope so. You're given anesthesia, according to the Board of Anesthesiology of the United States. So you should take a blood pressure first. You know that. Do you do a Clifford test? Jess Clifford, back there in the corner. Do you do a Clifford test if someone comes in and tells you I've been diagnosed as multiple chemical sensitivity before you start doing different restoratives in the mouth? You should. At least recommend it to them. And then you have to make up your mind if they say, no, do you want to get involved in this? But you should. And I would say, oh, let me go back to what I used to say here when I spoke before this group before. Do you do a culture before you launch into biocompatible periodontal therapy? You should. You don't know what your enemy is unless you do a culture. So those are three basic things, and I don't think they're any more basic than do you remove mercury from a patient before testing for mercury toxicity? In the past, yes. But to use a dancing, thank you, to use a dancing, now you know better. You can't go back and do it the old way. So our standards for the BPT and the IAOMT are to do a culture before beginning it. So I would have people follow at least a nutritional regimen if they have mercury toxicity before I start taking mercury out. Again, I'd like to say thank you for listening. I'll be here when the question period comes up. It's an honor to speak to you. Thank you.